does he stand by his statement, there's no such thing as a hiring freeze, or does he accept that official statistics now show hiring has been frozen?
There are more doctors and more nurses working at Health New Zealand today than there were in 2023. We're investing in frontline health workforces and we're focusing on delivery.
Why did he try to blame senior doctors for longer waits for treatment when it is his government's hiring freeze that means New Zealanders are going without the care they need?
Well, Mr. Speaker, I was very clear when it came to the union deciding to go on strike that they should have put the offer that was presented to them a week prior to the strike to their members to vote on, rather than going on a strike which has caused 4,300 elective treatments or first special assessments to be delayed. That's unacceptable. We must put patients first.
Question number 9. Debbie, just waiting for a bit of quiet.
A supplementary.
Oh, supplementary. Debbie Naruwa-Packer.
Thank you. How does the Ministry's decision to remove ethnicity as a factor in wait times align with his targets to reduce wait times when Māori are still waiting longer for treatment than non-Māori?
Mr. Speaker, our government is very clear. We're focusing on need and we're focusing on making sure that we are ensuring that patients get the treatment they need in a timely and quality manner, and that applies to all New Zealanders.
Order.
Point of order, Debbie Naruwa-Packer.
That was a mischaracterisation of the actual question. The question, which is an equity-based, policy-based, need-based, addresses Māori and Pacific Islands, and there wasn't actually an answer in that. Thanks, Judith.
Minister could say the same thing again if he likes.
Well, Mr. Speaker, the government is focusing the health system to treat people based on the need that they have and ensuring that all New Zealanders can get the access to timely and quality health care.
Supplementary.
Supplementary.
Which one is getting this?
Well, because she was faster off her feet. Yes, she was. I'm pretty sure. Debbie Naruwa-Packer. It was like a blur. You could hardly see it. Debbie Naruwa-Packer.
Thank you. How will proposed cuts to Māori and Pacific health and immunisation providers, many of whom serve high needs, a hard-to-reach whānau, achieve his target to increase immunisation rates for children to 95% at 24 months?
Well, Mr. Speaker, this government is very much focused on delivering on the basis of need. We continue to invest in providers who serve a variety of communities to ensure that we are reaching out into Māori and Pacific communities so that we can meet those targets. But as I said in the previous answer, we are focusing healthcare delivery on the basis of need so that all New Zealanders can access timely and quality healthcare.
The Right Honourable Winston Peters.
Can I ask the Minister as to why on earth he hasn't consulted with Asa Verrill, who is an absolute expert on medical waiting lists and endless delays?
Is there another question?
Yes, a supplementary. How does his decision to cancel bowel cancer screening for Māori and Pacifica from the age of 50 align with his target to faster cancer treatment for 90% patients when these groups have the highest rates of bowel cancer in the country, with 18% of cases diagnosed under the age of 50?
Well, Mr. Speaker, we're focusing on, as I said, on healthcare delivered on the basis of need. We are lowering the age for all New Zealanders to be able to access bowel cancer screening to the age of 58. We're also making targeted investments to target those communities, Māori, Pacifica, Asian communities, where they have lower bowel cancer screening rates, to lift those rates so that we can save as many lives as possible.
Question number 9, Debbie Naruwa-Packer.
My question is to the Prime Minister. Does he stand by his government statements and actions?
The Right Honourable Prime Minister.
Yes.
Supplementary. Does the Prime Minister believe that Māori health outcomes have improved since his government dismantled Te Aka Whai Ora?
Well, what I can say to the member is that we are making tremendous progress. We're investing more, hiring more. We've set real clarity around the targets of what we expect to deliver for Māori and for non-Māori. Now we need a high-performing Health New Zealand to deliver it.
Supplementary. What specific action has the government taken under his leadership to address inequities in life expectancy for Māori and non-Māori?
Well, I'm very proud of the 5 targets that we've set in healthcare. We want people to have faster access to cancer treatment, Māori or non-Māori. We want to make sure that under 2-year-olds, Māori or non-Māori, are immunised. We want to make sure there are less wait times for emergency departments, first specialist appointments and elective surgeries.
Supplementary. Does he consider it unacceptable that Māori die 7 years earlier than non-Māori?
Well, we've got to continue to work hard to close that gap.
Supplementary. How can the Prime Minister claim to govern for all New Zealanders when Māori health outcomes are deteriorating under this government?
Well, I would dispute the characterisation of that question. I said this government has set clear targets about what we expect the healthcare system to deliver for patients, Māori or non-Māori. This is a government that's invested record amounts of money in the healthcare system. It's a government that's recruiting and expanding the workforce in the healthcare system, and it's given tremendous clarity to the system as to what it's to deliver for patients.